Hello viewers, how are you doing? This is Friedman Praise Melody. Today we are going to be discussing on the topic neonatal sepsis. So it would be very nice to subscribe to this channel, like this very video, share it to your friends. Okay, let's begin. Neonatal sepsis refers to an infection involving the bloodstream in newborn infant less than 28 days old. It remains the leading cause of morbidity and mortality among neonates, especially in middle and low income countries. Neonatal sepsis is basically divided into two groups, which is the early onset sepsis and the late onset sepsis. The early onset sepsis, this is the type of sepsis that occur in neonates at or before 72 hours of life, while the late onset sepsis is the sepsis that occur in neonates after 72 hours of life. Early onset sepsis is generally caused by transmission of pathogen from the female genitourinary system to the newborn or the fetus. This pathogen ascends the vagina, the cervix, the uterus, and the birth canal, so infect the amniotic fluid. Neonates can also become infected in utero or during delivery as they pass through the birth canal. Maternal factor that increase the risk of neonatal sepsis include delivery before 37 weeks of gestation and prolonged rupture of the membrane greater than 18 hours. Late onset sepsis usually occur via transmission of pathogen from the surrounding environment after delivery, such as contact from healthcare provider or the caregiver. A percentage of late onset sepsis may also be caused by late manifestation of vertically transmitted infection. Infant requiring invasive or intravascular catheterization or other invasive procedures that disrupt the mucosa are at high risk of developing late onset sepsis. Preterm neonates are at high risk of developing neonatal sepsis also. The increased susceptibility for infection seen in preterm neonates is mainly due to their deficient immune system, that is compromising innate immune system, and the increased need for invasive device. Neonatal sepsis may affect any baby, but premature babies develop sepsis more often than full-term baby because their immune system are immature. Babies born prematurely don't have antibodies to protect them against certain bacteria. That's because they are born before they can receive the antibodies from their birthing parent. Neonatal sepsis also more commonly occur in babies who are, or neonatal sepsis occur in babies who have low birth weight, low Apgar score, babies who are assigned male at birth, babies who have birthing parent with a certain risk factor such as infection during pregnancy. They are commonly susceptible to neonatal sepsis. The neonate sign that neonatal sepsis when you see it in your neonate or your child is they'll be presenting with fever, presenting with fast or slow heart rate, fastness of their breath or shortness of their breath, vomiting, diarrhea, reduced sucking, discomfort, quality feeding, swelling belly, abdomen is the standard, cold hands and feet, clammy or pale skin, seizure, and jaundice. When you see these signs, it's a pointer indication that my baby might be having neonatal sepsis. The complication of neonatal sepsis, normally you know that it will lead to morbidity and mortality, and also for very low birth weight infant, they are found to have high risk of chronic lung disease, and for extremely low birth weight baby, they are at high risk of neurodevelopmental problems neurodevelopmental problem. Let me pronounce it very well for you to hear it. Such as hearing and visual deficit, cerebral palsy, and impaired psychomotor and mental development. On the other hand, the unnecessary overuse of antibiotics can increase the chance of severe candidiasis and multiple drug resistance. So, treatment of neonatal sepsis should not be done at home by yourself because you think you can do it. When it comes to this, take your child, take your neonate to the hospital, a facility where you can see a doctor. When you take them to some clinic around you without, when the person there is not well nurtured or don't understand the treatment for neonate, wrong prescription can be given and it becomes a problem. So I always advise that when you have a baby, a neonate, and you begin to see any signs and symptoms of sepsis, neonatal sepsis, take them right to the hospital where you can find a doctor so that your child can be well managed. If you find this video very interesting, you do it to like this page, subscribe to my channel, share it to friends, touch the notification bell to be one of those who will be receiving my video always, and I post them